All right, so I think we have a good number of people to get started. Um, um, Good afternoon, everyone. We're so delighted to welcome you all today here. This is our second session in the Advancing Health Equity seminar series. This seminar series is really supposed to be a space to provide more information on the basics of community-engaged research, learn from others on their methods and practices in community-engaged research, and really consider how you might be able to implement those practices into your research. Our focus today is going to be on building and sustaining meaningful community partnerships. We're going to have a panel conversation followed by Q&A. I'll be co-moderating this session with my colleague, Devin Madden. For those of you I haven't had the pleasure of meeting yet, I'm Timnit Berhana, a program manager for the Institute for Health Equity Research Community Engagement Core, and I'll pass it to Devin. Devin, if you want to kick us off with the slides.
I am so sorry I had to exit the meeting and come back. My internet is cutting in and out, so I signed on to Mount Sinai's guest network. I'm not sure. Can you actually hear me?
Yes.
Okay, and I'm not cutting in and out for you all. We're having a
No.
little tech. Okay, great. So we wanted to just ground this in a couple of different conceptual models or frameworks that we often reference when we're doing this work, to just put them out there and provide them to you as a little bit of food for thought. As we're listening to our amazing panelists speak today, I am sure that many of the concepts that you see in these conceptual models will come up, especially this idea of trust and bidirectionality and inclusivity. I'm sure that many of the concepts that are in these models will be spoken to, but we wanted to just provide them so that you have them. We'll give them to you as resources after the talk. And we also just wanted to say that today is going to be about kind of breaking this down a bit and getting real about what this work looks like, because it can look really beautiful in a model. We can look and agree with all the principles and know what they mean and know what they stand for and know why they exist. But we wanted to just get beyond the science, beyond the sort of pretty model today, and talk about really what happens and what this work looks like. So we're pointing these out just so you have them as a reference, so that we know why they're important, but we're going to be talking about how these core principles really come to life. And so this first one is through the National Academies of Science. And what's great about this model is that it's really a model for health equity through transformed systems for health. And so what they sort of see in the middle here as the thing pulling all of this together is community engagement. So all of that to say, we can't reach health equity, we can't have transformed systems for health if we do not have community engagement that is following these core principles. If we go to the next slide. And this is another model. Again, you'll see that there's lots of different models out there. If you looked at the guiding principles of partnership that the Community Campus Partnership for Health provides, which we didn't include on this slide, we just included their authentic partnership wheel. You'll see that a lot of them mirror the ones that NASM has spoken to, because a lot of these concepts are tried and true and will come up again and again and again. But what we really wanted to highlight here is really that this will all lead to these meaningful outcomes, but there have to be some sort of quality processes that are grounded in trust, that acknowledge the history of mistrust, and that are committed to mutual learning and sharing credit that can yield transformative experiences. So again, just another way of looking at sort of a similar picture. And we're really lucky that today we get to learn from people who have been doing this work on the ground, who can talk about how these ideas live beyond a picture and come to life. And with that, I'll pass it back to you, Timnit, to introduce our panelists.
Yes, yeah, and we have a great group of panelists today who come with us with, a wealth of knowledge and experience on community engaged practices. I'll be briefly introducing our five panelists. We have Dr. Jamil Islay, an assistant professor in the Department of Population Health Science and Policy, director of anti-racist partnerships and community outreach in the Center for Scientific Diversity, and associate director of diversity, equity, and inclusion for the Tisch Cancer Institute at the Icahn School of Medicine at Mount Sinai. Next, we have Christopher Lito, the Director of Wellness Rising, Riseboro Community Partnerships Health and Wellness Program. Chris has been working in the nonprofit field for over 30 years, working on housing, senior and health-related issues. Before joining Riseboro, Chris was the Executive Director of Blackland Community Development Corporation, an affordable housing program in Austin, Texas. And we have Dr. Nita Vangipuram, an associate professor in the departments of pediatrics and population health science and policy, and is an associate director of the community engagement core of the Institute for Health Equity Research at Mount Sinai. Next, we have Gedi Arniela, director of community health and outreach at the Institute for Family Health, a federally qualified health center, and a faculty member for the Harlem Family Medicine Residency Training Program. She's been a co-PI on numerous NIH and CDC grants and is currently working on the New York Community Engagement Alliance, a national initiative and an NIH grant, along with NYU and Mount Sinai teams. Last but definitely not least, we have Crispin Goitia, who's the Engagement Program Manager for the Institute for Health Equity Research and the Principal Investigator for the Insight Data Network with over 20 years of experience in engagement. As I was saying, we're just so thankful to have you all here today and to just hear about your expertise in community engaged practices. I just want to remind everyone that we want to make this a very interactive session, so please feel free to drop your questions in the chat as we're going through the conversation, and we'll make sure to address as many of them during the Q&A. But yeah, without further ado, I think we can jump straight into our conversation. But I want to make sure I give the opportunity to our panelists to really share with us your history working together and partnering with CBOs and FQHCs and research teams over the years before we get into our questions.
And we can kick off with an introduction from Crispin.
So thank you all for having the opportunity, for letting me speak with you and meet with you all today. So experiences in working with communities and working with different stakeholders in the 20 years plus experience at Mount Sinai that I've had has really broadened my horizons and exposed me to meeting such wonderful people, which many are here with us today, but also understanding how important it is to be able to collaborate with others, because often we live in our own silos and our own set of expertise, and we forget that sometimes there's other people that could really bring a lot to the conversation. And in this particular session, we're really going to get into why it's important, the kinds of work that we've done together. I've worked with quite a number of you, with Gedi, with Nita, with Chris on our COVID work together, our engagement award, having had the opportunity to shape how we train people in community engaged research. And so all of that, I've learned so much from everyone, and really wanted to mention that and how grateful I have been for that opportunity.
Thanks so much, Crispin. We're gonna pass it over to Chris.
Hi, everyone. Forgive my voice. I had laryngitis the last few days, which made my family very happy, but I'm finally getting my voice back. So yes, to echo a lot of what Crispin said, my 30 plus years experience in the nonprofit world has taught me so much about partnership. It's about sharing the sandbox, appreciating everybody's strengths, learning how to be a good steward and help other organizations move through, and just identifying who you can work with, how you can work with, and how to build that partnership after the funding has ended, as we move on to other bigger, better, different things. So it has been an amazing time going through all of all of the pandemic with our partners. We've learned a lot, we've done a lot, and I'm certainly happy to be here today and kind of share some thoughts and experiences on how we can inform and move forward going on from here. So thank you.
Awesome. And Getty, I'm going to have you join.
Yes, good afternoon, everyone. Happy to be here with you all. I guess, over the years, I've had the opportunity to work with a lot of community members in East Harlem mostly, and to introduce researchers and folks that want to help the community to community members, to bring that partnership piece together, particularly when we've engaged in community engaged research. The thing that I've found that is incredibly helpful, first and foremost, is to have respect for the community members and to, help them to feel that they are important, because they are. You're trying to help their community, so they are the ones that know their community the best and can help you to be able to help them. So that in and of itself creates a partnership. To have a presence in the community really helps to establish you as a somebody that they can trust, right? So if you just arrive in the community because you have a grant and you feel that you need help to do it, it's going to really be difficult to engage the community. But to have a constant presence and to establish relationships and to allow the community members to see that you're there to help, if they ask for help, you try to do the best that you can to help them, and vice versa. When you need help and you've established those relationships, the community members will be there for you. So thank you for this opportunity.
Thank you, Getty. And I am going to ask Nita to just share a little bit about her experience.
Thank you all so much for coming to this session today. I'm very humbled to be part of this wonderful group. Similar to what everybody said, we've worked together over decades, have seen each other, build our families, build our careers. So I agree with what everybody said, and it really is it is about being there. I think that's the number one thing. And over the years doing work ranging from diabetes across the lifespan, COVID equity, social determinants of health, mental health, whatever the area may be, I think the common thread is sort of, those relationships that you have. And so I think we'll dive in, because I wanna make sure we get into some of the questions and can give some of our thoughts and then open it up to the audience. But thank you all so much for being here.
Yeah, so on that note, let's dive in. I think we're having a little bit of tech issues for Jamelia, so we'll just kick it off. And Tiffany, I think you have a question for Chris.
Yeah, our first question is, how do you define an authentic partnership and why is it crucial?
Okay, well, we define Riseboro an authentic partnership with that both parties are going to be able to get something out of the relationship, whether it's funding or information or contacts or an ability to help our clients. And you know, it's so important because at the end of the day, everybody on this call, hopefully, is thinking about how this is going to impact clients, people on the ground. And when you have effective partnerships, when both parties are getting something out of it, you're able to impact the people on the ground in such a tremendous way. So that's ultimately what we're looking at when we look at these effective partnerships. Can we do the most good for the people that both organizations or both agencies, whatever the case may be, are trying to help? Are we providing the most good? And that's always front and center when we're looking at these effective partnerships. And then everything else is secondary. It comes down to helping the people on the ground.
I love that. We see that term authentic partnership in a lot of these conceptual models, but hearing from somebody what that actually means and looks like to their organization is really important. And that bidirectionality is a big piece of it. It's not a partnership if there's nothing in it for one of the sides of the partnership, right? Partnership takes two. There has to be a what's in it for me for everybody. So that's great. I'm just going to move to the question for Crispin as Jamelia comes on and allow her a moment to get situated, and then we'll have her introduce herself. But Crispin, we're wondering, to get to this authentic partnership takes a little bit of work. And so just want to hear from you some of the strategies that you felt have really helped in establishing trust between partners at the beginning of a collaboration, at that onset.
Thanks, Devin. And so to me, the most important, crucial step is being transparent. Transparency, transparency, transparency. The more that you foster open and honest communication from the very beginning and really clearly articulate goals, expectations, and sometimes sharing each other what those roles will be within the partnership makes such a difference, because people can tell when you're being disgenuine. As Chris mentioned about authentic partnerships, authenticity is really important, and being genuine as well. And so that's really one of the key things that has been successful for me. Also thinking about a shared vision, that all partners really can work with each other, understand each other's perspectives, even if they're not all coming from the same place. Definitely mutual respect, so you can agree to disagree, and we'll get into that a little bit later, I believe. But the idea of mutual respect, regardless of people's expertise, lived experience, I think is really important. Thinking about the responsibilities that you all are going to have when you're building these collaborations and these partnerships is important as well. And being consistent with your engagement, following up, checking in, how are you? Yes, it's important about the work, but it's also important about the people who make the project and the work happen. And so if someone's not doing well, or their family member's not doing well, or something else in their life has just changed, then checking in is really, really important, because it shows that you actually care. And that goes a long way to developing trust and partnership with people. And so I really think that those are really important tenets to think about.
Paying attention and checking in. Thank you so much, Crispin. I'm happy to announce that Dr. Jamelia Sly has joined. Jamelia, I'd love for you to just introduce yourself to the room. We gave your introduction, but just hear from you a little bit about your background in community engagement. And also we have a question for you that we'd love for you to answer, which is, what advice do you have for organizations or research teams looking to initiate that first partnership?
Awesome. Thank you so much for the opportunity to speak to this group here today. I apologize for joining late. I am a community psychologist by training, so I got my PhD actually in this area, this field of inquiry. At Sinai, I've been here since a postdoc, and really much of my research has focused on developing and testing interventions to engage community groups, community organizations that are focused on developing or improving cancer screening outcomes in these underrepresented and underserved communities. So I've had the opportunity and really the privilege of working with a number of community-based organizations. The groups that I've worked with more recently have been focused in the African-born community, and I'm really excited about expanding the work that I've done and having the opportunity to work with some great folks in this area. To answer the question about how to begin these kinds of relationships, I mentioned kind of branching off and working with the new groups in this African-born community, because this is something that I hadn't done before. And so I think it's really timely to talk about what that process was like and how I came to form some of those relationships. So one way was really to kind of work within the networks that I had previously. So working with other faculty at Sinai who had some established relationships with groups like the African Services Committee, which I think a lot of people also have worked with them in the past. They're a really wonderful organization. But then also one of the strategies that we utilize, and I have to give a lot of credit to the team that I work with, so the research coordinators, we really just went into the community and looked for community events, things that were happening, festivals that were held, for example, that focused on the Ghanaian community. In the summertime, there's a lot of those things that happen. And we just attended them, introduced ourselves, and presented ourselves as a resource to those communities, and began to establish some connections in that way. So I think that is one way that I have found that has been really useful, is to go to these communities, to the events that they're hosting, and show our support for the work that they're doing, and then you know, begin to develop some trust in that way, and seek out opportunities to expand on what we are doing in that way.
Yes, really, just showing genuine interest and really being present and being among the community is very important. I hear that. And yeah, just related to that, and Getty, this next question is for you. We know that there are so many like priorities for organizations, but how do you balance your organization's priorities, and and how do you consider what research partnerships to engage with, and how do you balance it all out?
That's a three-part question to me. But basically, we're a federally qualified health center. We provide health care in communities that are Black and brown. There's poverty, there's a lot of health disparities. And so we look at a proposal that comes our way to work together to see how it would benefit the communities that we work in to be involved in this type of research. And we're pretty meticulous about ensuring that, none of the research that we're going to be involved in is detrimental to the community. We want to look at things that are going to help the community. Also to engage the community as partners. So if there's funding that we can, make sure that they receive, that's a big part of the decision to work together. And, of course, historically, we've done work with different organizations, and we have experience in what works and what doesn't, and also who's going to be a good partner in terms of research, right? So we look for equity in what we're going to do with a partner that's interested in doing research, right? We want to make sure that we're helping the community and also helping our patients. I don't know if I answered everything, Timnit. But I think we have a committee, right? If someone's interested in doing research with us, we have a committee that we ask the researcher to present their prospective research to us. And the committee really looks at it in detail and, goes through everything that I just talked about to make sure that it's a project that, will help the community, will help our patients, and that, we feel is important to the communities we serve.
Jamelia, go for it. I saw your hand go up.
Yeah, I just wanted to chime in. So we have done some work with IFH, which is also a wonderful organization to partner with. And I just wanted to echo what Getty was saying and mentioning about the research committee and how they really are engaged and really active in thinking about how the work that we propose to do with them will benefit the patient population, and making sure that there's no harm that will be done. And I found that it's a really great experience. They're really interested in what our questions are, what our research is all about, but also really invested in making sure that there's some benefit to the patient population, as Getty said before. So I think it's a wonderful model.
Yeah, and just building on that, I guess it's a follow-up question for you, Dr. Jamelia. In your opinion, what role does effective communication play in building and sustaining authentic partnerships?
I think it's a really critical component to effective partnerships. I think depending on who you're working with, the language that we use in academia is, it's depending on how long you've been here, we're all familiar with grants and contracts and those things. But I think for organizations who aren't in this area or this field, it can be harder to learn the lingo and become familiar with all the things that we have to do on our end. So I think just being able to effectively communicate, keeping the lines of communication open throughout the entire process for whatever it is that you're doing is really beneficial. And describing what you're doing in a way that people who aren't in academia will understand, I think has really been helpful for us, and kind of breaking down exactly why we have to do the things that we have to submit all these things for the GCO office, grants and contracts, what these processes are for, that sometimes can slow down the momentum. And so I think just communicating that with your partners so that they're aware that it's not something that I, would do on my own, but these are things that we're really mandated by the institution and our funders to be utilizing.
Yeah, that transparency is key. And I think like when we think about things like grants and contracts, I even working within a system like this get so overwhelmed by it that it can feel like something that you just don't even want to talk about because it's just so big. But having those conversations and being open, being transparent about those processes and bringing people along that long road with you that you're on as you're waiting for, whoever to sign that paperwork is really, really important. COVID was also a big disruptor to sort of the ways we communicate. It presented a lot of challenges, obviously, as we moved to a more digital space and relied on technology. We saw how tech can kind of make communication fumble happen when I couldn't even get on at the beginning of this call. But so Neeta, this question's for you, which is really like talking to both sides of that digital coin. What are the ways in which leveraging tech challenges the authenticity of partnerships that we build? And what are the ways in which it can enhance it?
Yeah, this is a great question, something that our team has really been grappling with, as you said, because of COVID, right? So before the pandemic, a lot of the authenticity, relationship, and trust building happened in person, right? Like people would be in a room sitting next to each other, asking, where did you go on vacation? Or what's happening with your kids? They might be sharing food together, during a meeting where they're talking about, collaborative things that they're doing together. And so the pandemic really threw all of that on some spin out axis, and we really had to pivot quickly, right? In the setting of everything that was going on. And so I do think in some ways it has been an amazing opportunity because we've been able to kind of increase accessibility to people. A lot of our community partners are all over New York. And so being able to meet virtually has actually allowed us to come together more regularly, which is a big part of building those relationships, just like seeing each other, even if it's on a screen, but seeing each other consistently. I think, we have to be careful that we invite people to participate in ways that feel comfortable for them. So I know like during the pandemic, even on a Zoom meeting, for example, we can say it's okay if you have your camera on or off. We'd love to see you if we can. But it's okay if you can't. People are fatigued sometimes being on camera all the time. You can use the chat if you don't want to talk out loud. Maybe we go into a breakout room to create more intimate settings so people feel more comfortable sharing their ideas. And then offering opportunity. I know in the early stages of the pandemic, when we were trying to convene groups really quickly and had crazy schedules, meeting at all kinds of strange hours of the day and night, really inviting some of these offline one-on-one interactions, whether that be email or just even a phone call. I know it sounds old school, but sometimes the phone is a good thing. to kind of figure out other ways to connect. And then just recognizing that everybody's comfort level with different technologies is different, right? So we have used and leveraged a lot of exciting tools like, you know, we've done stuff with open space technologies to kind of virtually crowdsource ideas for research. We've used things like Google Jamboard, you know, virtual sticky notes to kind of share ideas, or things like Poll Everywhere and word clouds. Like, these are all cool tech things that we can leverage, but not everybody's comfortable with that. So just acknowledging that and sort of building that learning curve into anything that you'd want to do. And I think where we're finally landing in this is really more of a hybrid space, right? So like, we can do a lot of our stuff virtually, and it's great that we can do that. But I think you know, we can speak to the times we've been able to see each other in person in the last few years. We valued that even more, right? Because we don't get to do it that often, but when we do it, it's a really critical piece. So sort of figuring out, when can we come together in person and make those experiences special and affirming, right? And then use the digital tools that we do have access to.
Yes, I agree. And being in person with all of you is so spectacular. So I'm just going to echo that. I'm going to move over to a topic that is maybe as hard as talking about grants and contracts, and is certainly related. This question is for you, Chris, and it's really about this rapidly changing landscape around grants and funding. And, you know, we all do a lot of work to build up these partnerships when we have the grant that's helping us fulfill the commitments and meet the needs on both sides. And then the funding ends. And a lot of times people ask us, well, how do you sustain partnerships when the funding dries up? So I want to just ask you for your considerations on that topic. How do we all work to ensure that despite the grant funding, when the grant comes to an end, we're sustaining the partnerships and that they remain relevant and adaptive over time?
Right. So this is the tough one, isn't it? For CBOs. You know, you're engaged for 7, 8, 12 months on a grant, and you're interacting with the community, and all of a sudden it dries up. You know, where does it go? And I think a lot of us probably have experienced that, especially during the first Medicaid waiver. We had all of these possibilities come out, all of these programs that we were working with each other on, and then the Medicaid waiver went away, and so many of these programs went away, and some of these partnerships went away. I think what Riseboro was very lucky with is that we connected with partners that had such an equal and strong desire to figure out how to keep things going, whether it was public health solutions or working with a health and housing consortium in Brooklyn, or working with Mount Sinai at NYU Langone. What we realized is that we were stronger together. So we were reaching out to our partners and figuring out what kind of money could be scraped together to keep any of these programs going in any way, shape, or form. And that's what we did. While, you know, big grants went away, we found grants to do things for $5,000, for $15,000, for 25, and we made it work. We were able to sustain some of these partnerships doing it. It's so important to do this because when we talk about the people on the ground, uh, certain areas, like let's just say Brownsville, which in Brooklyn, which Riseboro spends a lot of time in, there's such a feeling from the people on the ground there that they're asked to engage, they're asked to trust. They have these programs presented to them, and then it all goes away, and all sorts of headway and progress are suddenly just gone, and then people trust it less when it's offered again. It's kind of like Lucy and the football. You know, how many times can we offer the football and they go to kick it and you know they land flat on their back? So that's what Riseboro has done. Even though a lot of the money for the first Medicaid waiver left us in 2020, we partnered with organizations where we sat down and really figured out how to do things. And we've had some great success, whether it was little bits of money here with H&H or the Department of Health or NYU Langone. I think CBOs will all agree that we can do a lot with just a little bit of funding. Of course, we want a lot of funding. Don't get me wrong, but we can make do because we understand how to do that. And I've been doing that for a while. So yeah, I think we're stronger together when we see a problem. Let's sit down and figure it out together, because there's just a lot of smart people on this call. And there's a lot of smart people working in all these different departments all around New York City. And we've proven it. We can get things done if we have the will to do it.
That's such an important point, Chris. And, you know, we all run into this situation, right? You get the grant, you hire staff to work with you and, you know, and work with the community, and then you run out of money and the well is dry, right? So I love your idea of trying to find something, and maybe even from the beginning and as you go along and working through your project, to keep an eye out for other funding sources that, you know, will help, you know, the community. We worked on a project, diabetes prevention with Dr. Horowitz, and that project went on for 13 years, you know, like we kept getting refunded, and it was like a family, like all the community members that came to work with us, we were family. And then, you know, we kept getting refunded during that time, but when the money finally was like gone, it was like losing, you know, for them, it was like losing a family member, and for us as well. Like we just had gotten to a place where we were so close. So it's very important to do what you can to, you know, even if it's not the same project, to engage the people that have been there with you, you know, through the project, to continue to work with you in some way or other.
Yes, and I do want to speak what Dr. Sly said on the chat. It increases funding when we can all come together and nobody's kind of hoarding the money. You know, we've been so successful at reaching out to our partners, whether it's New York Academy of Medicine, you know, Public Health Solutions, Fifth Avenue Committee, whatever the case may be, Getty, and saying, here's what we can do as a team, and this is how effective we can be, and get the best bang for the buck. And it's always been very successful.
Yeah, definitely. Sustaining relationships beyond funding available is an integral part of community engagement. But so are like conflicts in, you know, like in any type of relationship, they're natural and they do occur. So Crispin, this question is for you. How do you handle disagreements or conflicts within partnership while maintaining the authenticity of the collaboration?
Thank you, Suni. So the most uncomfortable part of the conversation is managing conflict, right? There are often times where it could be within one group of people, it could be one person, it could be a multitude of reasons, it could be because of miscommunication or a misstep. And so thinking about all of those, right? The best ways to kind of effectively navigate conflict is open communication. I know we've heard that theme throughout our time together today. And I also implore you to actively listen. Listen to the people who are speaking in the conflict, who either agree are either who are on either side or kind of neutral. What are their perspectives? What do they think? Why do they think what they do? And then really understanding where they're coming from. As I mentioned before, even if we don't agree, we can agree to disagree, but at least understand where people are coming from. And when people feel like they're being heard, you're much easier to resolve a conflict when there's authentic listening and respect going on in that process, because people feel like you're genuinely listening to whatever the concern may be. And often it's something very fixable that you can resolve. And once you address what the crux of the issue is, then you can find solutions that can really help to manage those conflicts. Unfortunately, there are times though where the conflict can't be resolved. quite honestly. There just is too much tension and too much disagreement. And sometimes it's okay to say, we can't fix this right now, but maybe we're aware of what's going on and we can continue to try and repair it or find a solution for it, even if we can't right in the moment, which is hard for us as people because we always want to help everyone and, you know, pull our sleeves up and say, we can do this and fix it. But sometimes we can't fix it in the moment. So coming back to it, maybe with a clearer perspective, can often help resolve conflicts as well. That's been very helpful for me.
Yeah, I totally agree with you, Crispin. I also think that at the beginning of a project to sit down with the community partners that are working with you and sort of, you know, make an outline of the guidelines that you all want to follow, you know, so what do we do if there's conflict, right? And maybe each person, whether it's community members or researchers, they have equal say, right? So that they vote. And whoever has the most votes, that's the way it goes. That's what we did for 13 years. And it was amazing.
Worked. And we had plenty of conflicts in that partnership throughout that 13 years, but we got through it together as a group and we figured a way through and we were able to accomplish, you know, what we did. And, you know, I think that's really important because often, you know, nobody likes to think about conflicts. We want everything to be smooth sailing all the time, but that's just not reality. If we have them in our personal lives, we're going to have them in our professional partnerships as well. And so really just being open in the very beginning, communication again, right? Being open in the beginning and transparent about what the expectations are can also reduce the amount of conflict you have in a partnership as well.
Fabulous. So we are going to move on to just one final question. This one's for you, Dr. Bangipuram, but then we're going to get into the questions from the audience. And this is a little bit about conflict, but it's really about power dynamics within partnerships and acknowledging that sometimes they exist and wanting to just hear your perspective on how you navigate those power dynamics within partnerships to ensure that the collaboration is actually equitable.
Yeah, so this is a little complicated, right? But it's really boils down to what you said and it's acknowledgement, right? So there are inequities. We know that they're systemic. There are power structures in play and they're not equal. People don't have equal power all the time. So I think when we're going to communities and we're understanding research, like historically, the research enterprise or the health providing enterprises, you know, just putting it out there that things haven't always been great here, right? Like there have been things done to the community that were not fair and where one party yielded more power than the other. So I think acknowledging that and not just sort of putting it under the rug is a big part, right? Just saying this has happened, it hasn't been fair. Let's just talk about it and how we move forward. And then I think, you know, really acknowledging the strengths that different partners can bring, right? So, you know, there's always going to be, for example, like it might be a position issue where, you know, academia is the powerful one, or it's about the money, whoever has the money is the powerful one, or it's about decision making, whoever's making those decisions is the powerful one. But I think there are ways to even things out if, you know, you come together and say, okay, I can bring this to the table. As a researcher, I can bring my scientific expertise, I can bring maybe some funding dollars. As the community members or, you know, the population, they bring everything, right? Everything else that we need to actually make change. And so everybody's bringing something. And so then we have to figure out what is everybody bringing and then what resources do we have and how do we share them to kind of even out some of these inequities in terms of power dynamics. And we need to mobilize around issues that are really, the people are really passionate about. I think that like when we're working with communities, acknowledging sort of their historical expertise in activism, in fighting for things that are important, that kind of gets at some of these power struggles that happen and that create health inequities. And so really thinking about how our research, we talked a little bit about this at the last session, but research is knowledge, right? Which is power and can lead to change. And so really bringing sort of the activism piece into the research that we do and translating what we learn into things that are going to address the inequities that we see. And then I think just the collaborations that we build and sort of, we've touched on this from the beginning, establishing how are we going to collaborate in a way that we don't have these power dynamics, come up with those rules together. It could be bylaws that we make, it could be, playground rules, whatever you want to call it, but we're coming up with the rules. And then a governance structure. How are we making decisions? Are we voting? How many people have to be there for the vote to count? All of these things. And a lot of times when partnerships are starting or projects are starting, these are conversations that we can have to kind of establish those ground rules. And then we have to remind ourselves of them, check in on them. How are we doing with this along the way? And then if issues are coming up, troubleshoot them together. So that would be my advice. It's not easy, but I think just acknowledging that it exists and continually talking about it is sort of the best chance we have to erase some of those power dynamics.
I love that. I was just trying to put something in the chat about just appreciating that acknowledgement of the strength that our partners bring as advocates when we consider the systems of power and the structures of power that have tried to push people down and all that they have fought against. Like, you can't forget that. You have to remember that a lot of our partners are really strong advocates who will bring this work so much further. So I really appreciate you bringing that forward. Timnit, do you want to go to some of the audience questions?
Yeah, and please feel free to drop your questions in the chat, or also please feel free to come off mute and just, speak up. But as we're waiting,
Yeah, it looks like we have some that maybe came from the registration. So as we're waiting, we can start with one of those. And I'll just kick it off. This is for anyone, and just asking for you to share a really specific example from your experience of a partnership you had that had a significant positive impact and made a change that you're still thinking about to this day. So Getty, I know you mentioned that 13 years, but anything that you can share that's specific about what an authentic partnership really looked like that made a change.
Well, I think that partnership allowed us to raise awareness in the community about diabetes and how to prevent it. We trained a lot of community members to lead workshops, and that was wonderful. One of the things that happens when you get these grants, they are counting on you being creating something that's going to be sustainable, but it always means that they're counting on community members to do things for free, right? And that is so unfair, right? So that's part of the problem. But the effects, I mean, we brought in healthy foods. I mean, we just did so much in those 13 years that really had a very positive impact in the community. And it also led to developing a program for teenagers that were at risk for diabetes, which we're still working on with Dr. Vengipuram. Right. And during COVID, we adjusted that. We had to pivot to a digital program because, we couldn't get the teenagers to come out during COVID. So we worked on that, and it's really wonderful. So, things build on each other. And in the end, you gain knowledge, you gain experience, and so does the community.
That's great, Getty. And I think in speaking to some of those specific examples, we saw a little bit about how organizations might be able to speak to the success of their partnerships, but wondering if any of you have other tips that you might want to share about how organizations can measure the success of their partnerships. which is something that we're constantly called on to do, right? When we're writing in grant applications, you want to show that the partnership was effective and strong, and how might you think about measuring both engagement and the success of a partnership?
I'll jump in really quickly and just state that some of the most effective measurements that we've done of our partnerships and engagement is when we introduce a third party into it. By bringing in evaluators like New York Academy of Medicine and writing them into your grants and getting them involved at the beginning, you're able to ask those questions of how effective are you with your clients? How effective are you with the staff, and how effective is your partnership? And we've had a number of different projects evaluated by NIAM, and we always come back with better ways to improve our partnerships after seeing that kind of feedback. So just having that third party feedback can be very effective.
Thank you, Chris. Rennie, I think you had your hand up for a question, so go for it.
I did, thanks. Good to see everybody. I worked with Getty in the past, and of course, Crispin, Nita. Nice to meet you, Chris. I think one of the things that you've made me think about is, the conversations that happen between the principal investigator and, the community partner. But as we know, the research does extend beyond the PI, right? And so I just want to get your sense, because we've had this experience. How do you work with your investigative teams as well? How do you make everybody on your team also be aligned with the goals of the partnership? Like, I think that's a key thing for us to think about as researchers. So just if you could just explain a little bit of what you do and what you have to do to make sure that, that respect, that collaboration and all that also comes through your teams.
And Jamelia, I heard you talk a little bit about your coordinators and some of the folks on the ground earlier. So would love to hear more about that. But I also saw Getty come off mute. So whoever wants to tackle it.
Go ahead, Jamelia. I could say something after.
I was gonna say, I don't know that I can take credit for the team members. I think there's a certain type of spirit that you have to come to this work with, and kind of already have to be dedicated and really understanding what collaboration means within community partnerships. But I think just in general, what I hope I try to do within the team that I work with is to have a flat structure where it's not like, although I am the PI on a lot of the projects, I feel like everybody has a contribution to make. And I hope that folks who join my team or part of my team really feel like they have some ownership in the project, and really take that on and bring that to the work that they do, especially with regard to the partnerships that we have. So I think it's just something that the coordinators themselves bring to the table just by virtue of who they are. But I think, establishing what our team looks like, that there's not really a hierarchy that I practice, and that everybody has something to contribute, including our community partners, is the philosophy that I approached my work with.
Yeah, I totally agree. And, we're only as good as our team, really, because, if you're missing somebody, or if you think you're going to be able to do it all yourself, that's a real problem. I think, when I hire people on my team, I always look for their heart. I don't necessarily, I hire people that have never had any experience in doing community work. I just interview people and, just really assess, do they feel genuine? Are they really interested in helping the community? Do I feel that their heart is really in the work? And, and I always teach my team never to say, well, I did this, you know, we are a team. We should always use the we, because if you do something that's not correct, then it's all on you, right? But if you do something that's great, then it's all on the team, right? So forget the I, because it never works when it's I.
Yeah, I echo what everybody says, and I think choosing your team is really important. And the criteria that you use, I totally agree. It is hard at the end of the day, and really brings together everything, you know, what you were saying, Chris, about, you know, the partnership. It's really people who want to come together to do something good. That has to be there. And then I think you just have to check in regularly. So like choose the right team and then listen to them. I think that's really what it boils down to. And that means, you know, I'm not the PI sitting in some office and then telling people, you know, like the people who are, you know, in my case, it was even teenagers, right? Like telling us what we should be doing and say, okay, yeah, you're right. We're going to listen to you. And then that's empowering, and then it builds from there. So choose your team closely, carefully, and then listen to them. That is what I would say.
Well, and also go out with them. Don't just stay in your office, you know. It's important that, you know, you are also out there so that the community sees your face. You may not have the same team next time, but the community will get to know you, right?
Thank you all. Yeah.
Well, thank you all. I can just end by saying that obviously any team that gets to work with you all is lucky, because you look at their hearts, and I've had that experience, so I'm lucky. And I don't think everyone can say that, but this type of work does take a lot of heart, and it does take being with people that you love and that people who love the work. So thank you for sharing those responses. Thank you all for this wonderful session. You'll see that we put in the chat a brief feedback form that we ask you to please fill out so that we can continue to grow and make this series better. And we also put in the details for our next session, which is all on the ethical considerations for community engaged research methods. We dipped our toes into that pool a little bit today, but there's a lot to talk about there. So we hope that you'll join us on March 27th, same time and place, and the registration link is there. But thank you all for joining us, and we will talk to you soon. And thank you to our incredible panelists.
Thank you.
Thanks.